Hello, and welcome to Progressive Short Takes. What I want to talk to you about tonight is an interview that was done on Truthout on CJ Polychroniou, I think that's how you pronounce his name, was interviewing Robert Pollin, who is a professor of economics at the University of Massachusetts, and a very well-known professor at that. He's been on the lefty side for many years, and certainly qualifies as a democratic socialist. He's been an advisor from time to time to Bernie Sanders, and is well known in progressive circles, and also well known because he's the son of the former owner of the Washington Bullets, and I believe the Washington Capitals, but specifically Abe Pollin, who is his late father, if I recall correctly. I mean, I'm sure that Abe Pollin was his father. I'm not entirely clear on whether I'm talking about the late Abe Pollin or not. But anyway, let us go on. So Bob has made a fairly big impact, in economics as a progressive economist. And in his Truthout interview, he talks about a number of issues. One thing that drew me to this article is that he is someone else other than myself who looks at the performance of nations on the coronavirus, on COVID-19, in a comparative perspective. He's someone who compares nations. He notes that as of August 17th, we are approaching 170,000 deaths from COVID in the United States, more than triple the total death toll the U.S. had from fighting in Vietnam. That is the statistic, which is very interesting to note. He also says we have no evidence that the death rate will be declining significantly anytime soon. He puts the level of deaths at 514 per 1 million people by then. As of today, we are looking at 181,114 deaths here in the United States, only 8 days later, as of August 25th. And we now have 547 deaths per million and not 514 deaths per million. That's only 8 days later. And Bob Pollin, but then immediately compares that to Canada and says Canada's death rate is less than half of the U.S.'s at about 239 deaths per million. Canada today is up at 240. But he notes, and he's rare in this, that even while Canada itself is also a relatively poor performer, and then he quotes Germany's death rate at 110 per million, and notes they're still only a middling performer. And he cites then Australia's death rates of 15 per million. They're now up at 20 per million. They've had a spike there very recently. But he also cites 9 million in Japan, 6 million in, 9 per million in Japan, 6 per million in South Korea, and 3 per million in China, even though the virus first emerged in China. Now, a lot of people would not trust the Chinese statistics. I think there's been too much tangential confirmation of them to really doubt them seriously. I mean, maybe they're a little higher, maybe they're 6 per million or 8 per million or something like that. But the Chinese have pretty well contained this virus by taking very serious measures. I don't think any reasonable person can doubt that. Anyway, Bob Pollin says, if the U.S. had managed the COVID pandemic at the level of, say, Australia, fewer than 5,000 people would have died as of today, as opposed to nearly 170,000. Of course, we now have 181,000, as I said before, but that wouldn't have made too much difference. Maybe 5,100 people would have died. In other words, maybe that would have been comparable to 5,100 people dying in Australia. And then Bob says, Vietnam is the most extraordinary case. It has experienced a total of 22 deaths in a country of 95 million people, which amounts to a death rate of 0.25 per million. And he says this is for a country in which the average per capita income is about 3% of that in the United States. It is also a country, of course, that U.S. imperialists tried to destroy a generation ago. If the U.S. had handled COVID at Vietnam's level of competence over the past 8 months, then fewer than 100 U.S. residents in total would be dead today from the pandemic. So, we have to conclude based on that part of the interview, we have to note that Bob strongly agrees with me that we have handled COVID terribly with a level of incompetence that is seen in only a few nations in the world today, and nations with far fewer resources than we, far less wealth than we, far less technical competence than we, have managed this illness to protect their populations while we have miserably failed. Now, turning to the economics, in terms of the managing the pandemic-induced economic collapse, the massive $2 trillion stimulus program that Congress passed and Trump signed in March, the CARES Act, did provide substantial support for unemployed workers. Of course, it also provided more than substantial support for big business, didn't it? But anyway, 56 million people, 35% of the entire U.S. labor force, filed unemployment claims between March and August. I believe that figure is now higher than that, but we'll leave it at that for the most part. For the most part, they all received $600 per week in supplemental support, which more than doubled what most would have received otherwise. He says the CARES Act did also deliver huge bailouts for big corporations in Wall Street. Adding everything up, it was clear even at the time of passage that the CARES Act was not close to meeting the magnitude of the ongoing crisis, the economic crisis. It provided only minimal support for hospitals on the front lines fighting the pandemic, and even less support for state and local governments. The Upjohn Institute economist Timothy Bartek, Upjohn, as you know, is a pharmaceutical company, right? And that's their research institute. Their economist estimated state and local governments are staring at upward of $1 trillion in budget shortfalls through the end of 2021, equal to about 20 to 25% of their entire budgets. If these budget gaps are not filled in short order, we will begin to see mass layoffs of nurses, teachers, school custodians, and firefighters. Of course, these budget cuts will only spread and deepen the ongoing economic crisis. So there we go. As you know, House of Representatives passed the HEROES Act, an even larger $3 trillion stimulus measure, in May, towards the end of May. It included $1 trillion in support for state and local governments, but Trump and the Republican majority of the Senate have blocked action on this for the past 3 months. Meanwhile, 16 million workers have now lost their $600 per week in supplemental benefits, and state and local governments are teetering on collapse. He says Trump appears to want to make unemployed workers in public sector programs starve, perhaps so he can appear to swoop in and bail them out right before November's election. Trump has held out a compromise proposal with Democrats. This would feature a payroll tax cut that would permanently decimate Social Security and Medicare. As you know, I don't agree with that assessment because I don't think that the appropriations for Medicare and for Social Security are dependent on the trust funds. And I refer you to previous live streams and videos of mine and blogs of mine for the arguments as to why the payroll tax cut would not have to decimate Social Security and Medicare at all, that would be up to the Congress, and that would not have anything to do with the payroll tax cuts that Trump had planned, or even with the total removal of the payroll tax as the funder, as the so-called funder for Social Security and for Medicare. But apart from that, Trump also wants any new stimulus program to also incorporate his current top priority, which is to destroy the U.S. Postal Service in time to prevent people from voting against him through mail balloting. The next subject that's taken up in the interview is basically what are workers to do, and noting that in the European countries, they fixed this by basically nationalizing payrolls, and the issue raised in the interview, was whether the performance of Europe, in many of whose countries, there was only an increase of less than 1 percentage point in the jobless rate. And the question was asked, isn't this a strong enough reason why the U.S. needs a European-style social welfare state? Then Bob Pollin notes that a bill was introduced by Pramila Jayapal, a leader of the Progressive Caucus, who introduced the Paycheck Guarantee Act, which would basically have nationalized payroll here in the United States, both for all private and public sector employers of all sizes. That includes the states. Despite the fall-off in revenues these entities will have experienced resulting from the pandemic and lockdown. And he says throughout this program, there would not have been significant increases in unemployment. Workers would also not have lost their employer-based health care coverage. This plan was similar in design and scope to policies that were in place in several of the European economies, including Germany, the UK, Denmark, and France. 4 months later, the results of the failure of the U.S. to pass the Jayapal proposal are before us. By the way, that was Nancy Pelosi's proposal, her policy of not even considering the Jayapal proposal. So it was not just the failure of the U.S., not just the failure of Trump, not just the failure of Mitch McConnell. It was the failure of Nancy Pelosi and the House Democrats to not take that proposal seriously. As of the most recent figures of this past June and July, our unemployment rate was cataloged at 10.2%, while the rates for countries that had the Jayapal-type programs in place included the UK at 3.9%, Germany at 4.2%, Denmark at 5.8%, and France with the highest rate at 7.7%. The average for the European Union as a whole was 6.2%. For the U.S. economy, the difference between having an unemployment rate of 10.2% versus 6.2% translates into 6.4 million people without work. Bob Pollin notes more people than the entire populations of Los Angeles and Chicago combined. He says, so yes, certainly on average, Europe has handled the unemployment crisis much better than the U.S., but this is not the time to be making sweeping endorsements of recent policies and actions in Europe in terms of managing the COVID crisis. The UK, France, Italy, Spain, and even Sweden have death rates comparable to that in the U.S. He's correct about that, of course. Unemployment is 15.6% in Spain under a socialist government, he points out, and is at 9.2% in Sweden under the Social Democrats. In fact, policymakers in Europe have been undermining their welfare state policies for 40 years now, since the ascendance of neoliberalism, beginning with the election of Margaret Thatcher in the UK in 1979. And he says it is a valuable exercise for us to envision what the late great economist Robert Heilbronner used to call, quote, slightly imaginary Sweden, unquote. But in doing so, we need to recognize that egalitarian policies in Sweden today bear only a weak resemblance to the robust welfare state that operated there 40 years ago. Then Robert Pollin was asked a question about, well, what if the coronavirus never goes away even when vaccines arrive? In such a case, how can we best combat cyclical unemployment, ensure there is no precipitous decline in the standard of living for working class and middle class Americans? And Robert says, I'm not an expert in assessing how long it's likely to take to bring COVID-19 under control in the U.S. or assessing the likelihood it could remain as a public health threat indefinitely. But in the event we're faced with the virus we cannot adequately control, even through universal vaccinations, then I would say it is time to start learning from Australia, Japan, South Korea, China, and I myself would add Taiwan. Okay. And Bob Pollin says, and in a great historic irony, maybe especially Vietnam, about how to create a public health system that minimizes the spread of the illness. Okay, again, I point out that we should perhaps especially learn from Taiwan, first of all, because it would be politically easier for us to learn from them as opposed to looking to Vietnam, and also because they scaled up our own Medicare system there. And it was in large part that system that helped them to overcome the coronavirus. That system plus very good contact tracing and testing and being rigorous in being sure that there were no super spreader events taking place and that incoming travelers were carefully monitored. And by the way, in Taiwan, there are a huge number of incoming travelers because lots of people who are from Taiwan go home to see family for the Chinese New Year in China and then come back to Taiwan. And they had to be tracked and they had to be monitored when they came back to stop the spread. Millions of people coming back in a country with roughly 24 million people. But they managed it. They were successful with it. And with a Medicare for All system, as I say, like our own, but scaled up. Step one would be to establish Medicare for All, says Bob Pollin, so that every U.S. resident has access to good quality health care without having to fear financial ruin should they get sick with COVID or anything else. Creating something resembling a minimally effective healthcare system through Medicare for All would in turn enable us in the U.S. to advance a sustainable recovery on the foundation of a green but New Deal. So then Bob advocates for the Green New Deal and the possibility of the Green New Deal creating a new full employment economy over the long term. And he says, we first and foremost need government policies committed to maintaining levels of public investment that will be sufficient to create an abundance of decent jobs at all levels of society. It's also obvious that at this historical juncture, we desperately need large-scale public investments for at least a generation to build a green economy. As such, the full employment policy framework merges fully with the matter of saving the planet. Then, of course, Bob has asked the question, should the Biden-Harris ticket win in November? Now, do you expect that we will see fundamental changes in government response to the quadruple crises of health, climate change, racial injustice, and a ravaged economy? Bob says it's no secret that Biden and Harris are both corporate and Wall Street-friendly Democrats. If we're going to wait for them to enact fundamental changes in U.S. government policies, it's going to be an awfully long wait. But it's also clear that the Democratic Party can be pushed to the left, or to put it more accurately, the Democrats can be pushed to support, among other things, a public health system that can save lives and deliver quality health care at much lower cost than we now pay, and a Green New Deal program that can prevent a climate catastrophe while also serving as the foundation of a full employment economy. Stamping out racism and sexism will also have to be central to any such agenda. Making progress in fighting racism and sexism will in turn also be greatly strengthened within a broad agenda advancing equality and ecological policy. He says, we know that Democrats can be pushed in this direction by comparing the official platform they're enacting this week relative to what they passed in 2016. The current platform is far more progressive than the 2016 version under Hillary Clinton. It's true that such platforms are almost entirely ignored the day after they become ratified at the party's conventions, if not sooner. But that brings us to the real question, which is, who is capable of effectively pushing the Democratic Party to embrace the truly progressive features of the party platform? And he says it will have to be the range of organizations and people that have committed to such projects for a long time, including grassroots groups such as the Labor Network for Sustainability, Jobs with Justice, the Maine's People Alliance, and many more, as well as progressive groups such as the Progressive Democrats of America, Our Revolution, and the House Progressive Caucus. If we're going to succeed in building a transformative political project emerging out of our current historic moment of multiple and severe crises, grassroots and progressive groups are the ones who will make it happen. Certainly not Joe Biden or Kamala Harris. I thought that last part was right on. But what I missed in it was an advocacy for progressive movements and progressive groups to look past the Democratic Party while continuing to work with it, to look past it and to begin to work with and work to build third parties that supported the transformative agendas of the Green New Deal, okay, and including Medicare for All and the federal job guarantee. And I didn't see any mention from Bob Pollin in that. However, I do think this interview is worth noting and worth thinking about. And in another progressive short take, I will certainly take up the political situation of how we go forward, okay, at this time. I've been doing a lot of thinking about it, okay, along with lots of other progressive live streamers who are very loud about it as well. And I'll be talking about that soon as well. So that's this progressive short take. And I will see you very soon with another one. This is a little longer than I wanted, of course. But before I go, I am going to remind you of my Patreon account, which is at patreon.com/Joe_Firestone. Thank you very much for coming. Thank you very much for staying. And thank you very much for helping me to do these videos.